Good morning, class. Today we're going to continue our discussion on the urinary system. So go ahead and grab your study guide that we've been working on, and we're going to start on number 14, different types of catheters. There are invasive catheters and non-invasive catheters. Now, you will not be inserting these catheters. They will be inserted by the nurse, but you may need to assist them. So the first type is an indwelling catheter. It looks like this, and the bag must hang below the bladder and not on a bed rail, but it must be on the bed frame. And the reason is, if you pull the bed rail down, you're going to pull on that catheter, and we do not want that. The biggest thing with catheters are being exposed to microorganisms that may cause a UTI, which we discussed yesterday. So the first one we're going to talk about, the indwelling catheter, is this catheter. This is what it will look like. This part will go inside the body. Remember, a male's urethra is a lot longer than a female's. So when you see these placed, you're going to see it placed a lot longer in a male than you will a female. So, and then this little end is connected to the bag that's shown in the picture that I showed. When these are placed, we want to do it. It's got to be a very sterile procedure so that so we don't connect any microorganisms into this person, because we do not want them to get a UTI. So that's something we're always going to be continually monitoring. This type of catheter stays in the system for a long period of time. It's usually for someone that is unable to urinate, or their bladder is holding too much urine and they're unable to expel it all. This will be in, like I said, for a long period of time. The next type is a straight catheter. Now, this is seen usually when somebody just got out of surgery maybe and had a catheter for a little bit, and then we stop the catheter and then they're having a hard time getting their back. Because remember, your body adapts to whatever it needs to. So when we straight cath, you're going to take the catheter. Well, you won't, but the nurse will. But you may need to assist, again, with the tray. The straight catheter goes in the body, we expel all the urine, and then we take it out in a sterile procedure. Remember, these are invasive, which means that they are being exposed to microorganisms, so we need to keep very clean and sterile. The next type is going to be a suprapubic catheter. You're usually going to see this on maybe a paralyzed patient. It is in the abdomen, and it's just this catheter that goes into the abdomen, and it stays in for usually 3 to 4 weeks, and it's changed out. But that's something you might see, and it might be a little different because it's not something that a lot of people have. A few non-invasive ways of using a catheter is going to be a condom catheter, and it is placed on just like a condom, and it's not inserting into the body at all. This right here is going to be connected to the bag, and so that way it's got a little sticky film to it, so it stays onto the meatus, the penis. The next one is going to be a female catheter. It's called a Purewick catheter. And this is non-invasive. This is fairly new. So what this does is it lays in between upon the vagina, and it lays in there very nice and softly. It's got this nice spongy feeling type film. So then all the urine will just go in through here, and then it's connected to a bag as well. So those are your non-invasive and invasive catheters. Does anybody have any questions about catheters at this time? Okay. The next thing we're going to talk about are the different types of specimens that you may be collecting. The first one is going to be a clean catch specimen. So this is going to be midstream. Before collecting this specimen, you're going to need to wipe. Each container comes with 2 wipes usually, and you're going to wipe from front to back to not dispose of any bacteria from your rectum. So they are going to wipe their area 2 to 3 times. They're going to urinate into the toilet a little bit, pause, as the Kegel exercise from previous discussion of yesterday, and then they will urinate into the cup, and then they will finish urinating into the toilet. So that is why it's called a midstream. We're literally getting the midstream of the void. Remember, void, that medical term we discussed yesterday as well. Another type is a routine. This is any stream of urine at any time during the void. We just need to collect this. The clean catch is usually done for urinary tract infections. That's why it's got to be in the midstream. We don't want any bacteria to get in there from the body or from the hands. So they should always wash their hands prior to collecting that specimen as well. The next thing is a 24-hour urine collection. This is a little difficult, and it seems to have it seems to be a little more difficult for people to continue this collection because it is a full collection of the urine over a 24-hour period. There is a big jug that you will be placing the urine in every time they urinate, and it is placed on ice for that full 24 hours, usually kept in the bathroom of a facility. So when collecting this, the main thing, and this is going to be a question on your test, so make sure that you're making notes. When you're collecting this, the first void you will throw away, that will be dumped in the toilet. It will not be saved, but that is the time that the 24 hours starts. Therefore, the time that it stops is that exact time the next day. So a full 24 hours. You will, every collection that they void, every urine that they do, you will put into this container and save it for that particular 24 hours. Usually if somebody has kidney stones or something, they're gonna test all that urine and it'll tell them all kinds of different areas. What, you know, do you have a lot of calcium in the body and different things like that that will be included.